Governor Charlie Baker said yesterday he expected the vaccine booking process would be smoother today, in part thanks to a new digital waiting room that was added to the state's website. Well, at least it didn't crash. But this morning's experience was anything but smooth, with reports of some wait times as high as 50,000 minutes. That's roughly 35 days. For many others, the numbers jumped around from hundreds of minutes to just a few. But as wait times went down, so did the available appointments, which were quickly all booked up. That part is unavoidable. Governor Baker was asked about all of this and more in a hearing before the state legislature about the vaccine rollout today, which at times got heated, especially in regards to that website.
How much more streamlined would you like it to be than that? You remember saying that?
That is exactly how people access and have booked 300,000 appointments on that website since it went live
you
in
acknowledged
January.
it wasn't working well after that because there was an outcry after those comments.
The biggest challenge with the website from the beginning has been supply and the fact that people get frustrated, and I understand why, when they can't access an appointment.
Nobody disagrees with you that the supply is limited. But in theory, if 1 million doses were available in the state, but the website still crashed, it wouldn't have made a difference.
What happened to the websites on us, I was
Will you say
incredibly
sorry
upset
to
by it when it happened.
sorry to the 1 million people?
Of
who you
course,
told the
absolutely,
website would be
definitely, yes.
As for what led to the crash, we also got some insight from Tiffany Tate. She's the CEO of PrepMod, which is the company that built the site.
Did PrepMod receive notice from the state of Massachusetts to expect such a surge in advance of the cohort opening up for vaccine appointments?
We had knowledge that this was coming. I personally did not know that it was happening on that particular day.
She wasn't told 1 million people were about to be added to the eligibility pool. As for the rollout as a whole, Governor Baker emphasized the progress made in going from the bottom 10 states to the top 10 as far as getting first shots in arms, according to the Washington Post. And to that end, Baker announced at a press conference after his testimony the state will move to the next step of its reopening plan on Monday, which will raise the capacity levels for a number of businesses, including indoor performance spaces, indoor recreational facilities. It also means no more capacity limits for restaurants, though distance and time restrictions remain. And on March 22nd, the state will let large venues like Fenway, Gillette Stadium, the TD Garden open up at 12% capacity. But while the state has made progress, as several speakers argued today during the hearing, the road ahead looks a lot lumpier and bumpier, to use the governor's phrase, for some, particularly people of color, than others.
The impacts of COVID-19 was not a surprise. As someone who has seen a lot of pain and suffering and death and has experienced that in my own family and seeing it in the community, it is hard to find the words to describe the level of frustration in the fact that we knew that this was going to happen and in the fact that this isn't new.
There's a sense, Madam Chair, that trying to get a vaccine appointment in Massachusetts is like trying to win a lottery. And if that were the setup, that would be understandably frustrating and stressful, but it would at least be some version of fair. However, a first come, first serve rollout is not a lottery where everyone has an equal chance to win a fast vaccine. It's a raffle. English speaker, ticket. Never experienced medical racism, ticket. You have a car, ticket. You could not find a more textbook case study of structural racism if you tried.
Those two speakers join me now. State Senator Sonia Chang-Diaz, chair of the Joint Committee on Racial Equity, Civil Rights, and Inclusion, and Atiya Martin, a member of the Black Boston COVID-19 Coalition, former Chief Resiliency Officer for the City of Boston, and the former Director of the Boston Public Health Commission's Office of Public Health Preparedness. She's also the founder of All Aces, Inc. It's a Boston-based organization that focuses on diversity and equity training. Atiya, Senator, it's good to see you both. Thanks for being here.
Good to be back, Jim.
Always good to see you, Jim.
Thank you so much. You two focused on equity, so let's us focus on equity. Senator, starting with you, Governor announced yesterday $4.7 million targeted to 20 socially vulnerable communities for vaccine issues. The day before, Michael Curry was here complimenting the governor for directing money to community health centers. So what is the governor not doing that he should be doing?
Well, fortunately, we have a really crisp articulation of a roadmap that I and others, including Dr. Martin, there's a coalition of folks called the Vaccine Equity Now Coalition, as well as the Black Boston COVID Coalition. The Vaccine Equity Now Coalition has articulated 5 points of things that need to happen right away. One of those is $10 million worth of investment in direct grassroots communication, targeted communication to the hardest hit communities, and support services to get people connected with vaccination, whether it's information, transportation, and just letting people know what they need in order to sign up. So that's, for starters, is that $10 million investment. We need clear sightlines of who's accountable for this work. We're looking for a crisp assignment of who's going to be in charge of vaccine equity for the state so that there's clear accountability for this. We're also looking for transparency and benchmarking, right? What even are the goals by which we're going to measure success? And I know you got another question for me, so I won't go through the rest of the list, but there's a clear articulation.
That's fine.
Here.
Well, let me move to your colleague here. Since you were involved in putting those together, let me potentially add one to the list. Marty Walsh announced today, your former boss, by the way, I should say, Marty Walsh announced today that 50% of the doses that will be administered at the Reggie Lewis Center would go to people of color and other vulnerable communities. Is that the kind of thing the state should be doing well beyond the borders of Boston?
Absolutely. In fact, we can do even more, right? So if we're thinking about equity, we think about the how we have already distributed the vaccine. Communities of color, poor people, and other marginalized groups or underestimated groups have already lost out on much of the doses that have already gone out. And so 50% of one small of a site really limits the possibilities of closing those gaps. I do appreciate the fact that we're doing it. And in fact, Black Boston COVID-19 Coalition is partnering with the city on being able to leverage that 50% and getting people access to that site.
Sonia Chang-Diaz, I want to go back to you. One of the tweets you put out this morning, you said the governor was asked a question about how he measured success. And you, I believe, said something like he didn't have a crisp answer. Here's what I assume he would say was his answer. Here's the governor during the hearing.
We're second in the country with respect to the percent of our Black residents who've been vaccinated and are several points above the national average for our Hispanic population as well.
What's your reaction to what the governor had to say, Senator?
Yeah, I mean, look, I think we are starting to inch in the direction of the right conversation where we are at least naming some metrics and getting into a discussion about what are the right metrics. So that's a positive step. And I'm glad that to hear the governor, to hear those passing through the governor's mouth. The problem is that the sort of, if we benchmark ourselves only to other states, I would argue that that's not the right benchmark. It is saying, as long as we're better than somebody else, then we're doing enough. And that's a very familiar argument to me. I remember when we heard those arguments around criminal justice reform, when we said, but we're locking up way fewer people in Massachusetts than any other state in the nation. And that was true. But if you look at Massachusetts compared to almost every other country in the world, we're way higher. And we were 4 to 5 times higher than we were, 30 or 40 years ago. So the question is, I think the right benchmark is not, are we doing better than a terrible situation elsewhere in the country, but how are we doing compared to where people are getting the most COVID infections, right? We need to match our vaccination rate to what our infection rate is if we mean to really achieve equity and parity.
Tia Martin, the issues, I assume you'd agree that the issues about how you get to equity are in part about access, which we've been talking about, but obviously another issue is hesitancy. And one of the people on your panel, Gladys Vega from the Chelsea Collaborative, in part addressed that. Here's a little bit of what she had to say.
I do my best to convince people in my community that getting vaccinated is the right thing to do. But it's very hard because I convince them that I have to wait for an appointment in a system that doesn't work, in a system that crashes, right? So imagine, it's like convincing, you guys are elected officials, convincing a voter to come with me that I'm taking you to the poll. And then they say, oh, he's not in this list. And you're like, oh my God, I finally brought him to the poll. And now, but this is about life and death.
Tia Martin, are we making progress? And what specifically should the state be doing to address a critical issue, people not willing or too scared to take the vaccine?
Well, there's a couple of things. I think one thing that Ms. Vega was very explicit about is that people are overcoming their fear of taking the vaccine and then not being able to access it was her main point. But in terms of addressing the hesitancy that we're hearing is to understand that it's part of a much bigger picture and story, right? In that there's a huge information gap in terms of good quality information that people can have access to. So it being on a website and being on social media and people doing press conferences does not get to the people who are most marginalized in our communities. That's why we tend to know this. And this is something that Senator Chang Diaz has said the other day that I used to say when I was Chief Resilience Officer, which is we tend to know to do on the ground work, door knocking, all those things when we're running for office. But then when it comes time to implement policy and really do work, implement programs, somehow we forget that that's a thing that needs to happen in order to reach people.
You know, when I hear both of you, and I'm nodding in agreement saying that's a good idea, that's a good idea, Senator, rather than taking, and everybody is taking shots at the governor, and by the way, I am included in that category. I'm not talking about some other people. If the legislature, in coalition with other organizations and people, have better ideas, why don't you pass a damn bill and put it on the governor's desk so that we get action on the things you think there's inaction on?
Well, Jim, we should. There's no question. That's why I filed legislation together with my sisters in service, Senator Roush and Representatives Miranda and Dom. We filed the Vaccine Equity Act that contains a huge amount of overlap with the 5-point plan from the Vaccine Equity Now coalition. If the governor doesn't act, the legislature does need to be ready to move expeditiously. But look, you know, the governor is the chief executive in a time of crisis. So it's not crazy that we're bringing plans to him first and saying, hey, can you please do this? And look, this is not about taking potshots. Like, we all need to remember and keep in mind that we need the governor to succeed, and the governor's success is all of our success. And so I hope keenly that he will say yes to this plan and we won't need to pass legislation. And I want to lift up some things that he has done right as well. You know, he did prioritize congregate care facilities and workers in phase 1. He did it in a quiet way that is deserving of praise. But it's not enough, right? There are many more things that we need to have gotten right by now. And that's why, you know, we're making this push. It's not about feelings. It's about what we need to do to save people.
Tia Martin, go right ahead, sure.
Quick to that, because I think there's a pattern that I've seen with leadership, working with kind of organizations across the country, that leaders tend to think that they have to solve all the problems on their own. They tend to surround themselves with a small group of people and listen to that small group of people. The challenge with that is when it comes to government, when it comes to any organization, you're only getting a small piece of the available information in order to make good decisions. And so this is what we're seeing right now. So when you're more collaborative, when you're working with local public health, when you're working with communities, you get the kind of information that prevents you from making the kind of decisions that have been made up to this point. You get that information so that you can work in partnership with people to implement on the ground, because no one expects the governor or any of the state employees to just figure it out by themselves. The goal is that we're working together to get this work done. And so, yes, we all want the governor to be successful. And that requires a level of partnership that this administration hasn't quite displayed yet.
On that note, we'll have to leave it. I hope you two will come back and talk to us more, and I hope you make a lot of progress in between. Thanks so much, Tia Martin, Sonia Chang Diaz. I really appreciate your time.
Thanks, Jim.
Thanks.